Hi everyone, my name is Palmira Carlos. Today I will talking about child abuse. Child abuse happens when an adult hurts a child on purpose. This can be physical, emotional, or sexual. According to the World Health Organization, child abuse includes harm, neglect, and exploitation. There are different types of abuse. Physical abuse means hitting, shaking, or burning a child. Emotional abuse means shouting, humiliating, or reject a child. Sexual abuse means involve a child in sexual activity. All this type of abuse can damage child's health and development. For now, I will talking about social care. Social service play an important role is protect children. They help to keep children safe and support their recovery. Their main roles include preventing abuse, protecting victims, giving professional support, reporting abuse, providing foster care when needed. However, social works with scholar, police, and health service. Together, they try to create a safe environment for children. And in conclusion, child abuse is a serious but with strong support children can help. Thank you for your listening.
Hi, my name is Helena Bulungu. I'm studying health and social care. Today I will be talk about well-being and health and how child abuse affecting children. Well-being this means health in body, mind and emotional. Health is not all about not being sick, but also feeling good inside. Child abuse affects children in three ways. Emotional, children may feel sad and scared and anxious. They may have depression and stress. Psychology, they may lose confidence, feel unsafe, and have a problem at school. Physically, they may have bruises, broken bones, and pain. This problem can last for many years. Psychology, they may lose confidence, feel unsafe, and have a problem at school. Physically, they may have bruises, broken bones, and pain. This problem can last for many years. Hi, my name is Helena Bulungu. I'm studying health and social care. Today I will be talk about well-being and health and how child abuse affecting children. Well-being this means health in body, mind and emotional. Health is not all about not being sick, but also feeling good inside. Child abuse affects children in three ways. Emotional, children may feel sad and scared and anxious. They may have depression and stress. Psychology, they may lose confidence, feel unsafe, and have a problem at school. Physically, they may have bruises, broken bones, and pain. This problem can last for many years.
Hi, my name is Marinaldo Martins, and today I will talk about safeguarding and the NHS and how it protects vulnerable people. Safeguarding means keep children and adults safe from abuse, neglect, and harms. And in the NHS is a legal duty under Children Act or national policies. All healthcare staff receive training. This training helps them recognize signs of abuse, domestic violence, and neglect. The UK also use systems like Safeguarding Accountability Framework and CPAS to share information and identify risk early. And daily practice, safeguarding depends on the teamwork. Doctors, nurses, social workers, and mental health teams work together. They also work with MASH and social service to support people at risk. Trauma-informed care is important. It helps save understand how trauma affects behaviors and mental health. This allows professionals to record it with care, respect, and understanding. Overall, the NHS is a strong rules system to support safeguarding. Problems and improvements. However, safeguarding in the NHS is not always easy. One big problem is staff shortages and heavy workload, and professional is very busy and under pressure. This can delay reports, referrals, and support. Another problem is confidentiality. Staff must decide when to share personal information to protect someone. There are also communication problems between services. Sometimes agents do not share information well. This can put vulnerable people at risk. Because of the problems, safeguarding does not work perfectly, even with strong laws. So the main solution, better implementation, and the NHS need to training more, better digital system, and a strong teamwork. More investment in staff service is so important. In conclusion, safeguarding is essential to protect lives and dignity. With a good team leader, enough resources, and a strong cooperation in the NHS can be improved protection. Thank you so much.
Good morning, my name is Ingrid Silva, and today I will talk about how the UK government protects children from abuse. The government uses important laws to keep children safe. The Children Act 1989 says that a child's safety must always come first. It also gives the local authority the duty to investigate when a child is in danger. The Children Act 2004 asks school, health service, and police to work together. The Domestic Abuse Act 2021 says that children who see or hear abuse are also victims. The government also gives guidance called Working Together to Safeguard Children to help professionals work well together. Now we'll talk about social service. Local authorities, also social workers, have a duty to protect children. They assess children's situation and give support when needed. If a child is in a serious danger, they can use legal protection orders. Safeguarding works through teamwork between social service, police, and health workers. Checks and inspection helps help make sure professionals do their jobs properly. However, problems like too much work and low funding can make safeguarding harder. In conclusion, the UK has a strong laws, but services need more support. Thank you.
Good morning, everyone. I'm Leva here. In this part of the presentation, I'm going to talk about how school identify the child abuse and how they respond to it. Also, what's the role of the teacher and other member of staff of the school, and what impact it has on children's learning. As I mentioned in my slide, usually school recognize any kind of abuse early because children spend most of the time with teacher and other member of staff. So teacher or any other member of staff notice any kind of symptom, they should record it straight away and report it to the right team. So they have leadership team, those who deal with the children's safeguarding. So, and it's also suggested not to ask too many questions to the children because they might not be comfortable to share any information if you ask too many questions. So it's better not to ask, but assure them. Also straight away record and report. And that's the first step we need to take. So how do you recognize the sign of abuse? It could be their attendance, it could be their changes in their behavior. Sometimes they don't want to play with other children, and sometimes also you might see any unusual sign in their body, which is unexplained and unusual. So those are the sign you should think about it, and then you can go further. So let's talk about how is impact on their learning. In child abuse actually impact on their learning and daily life very massively. For example, they can't concentrate like they used to before, or they might have difficulties to remember anything. Sometimes they they don't want to mix with they don't even want to talk to anyone, and that's how they are falling behind academically. So it's impact really badly on their education. So overall, school has a key role to recognize the abuse early stage, also work with the other service, other agencies, so they can protect the child well-being. So that's all I wanted to say for my part of presentation. I hope you enjoy it and I made myself clear. Thank you. Thanks for listening to me.